We will now have the overview of this workshop from Kirsten, and she's the policy lead from Transform Health Association. And Transform Health work together with so many partners in the regions across the world over an year, and then brought out this health data governance principles, and that was launched earlier this year on 7th of May. And then AeHIN also conducted a regional roundtable on that. So we had very interesting inputs coming up. And then also like Transform Health also did this workshops around the regions. And then we have Kirsten online providing us the overview of what is expected from the member states moving forward from the principles more into action. Over to you, Kirsten.
Thank you very much. And it's a pleasure to be here. I'm just going to start sharing my screen to show a few slides. Can everyone see that okay? Sorry. Can you see my screen okay? And hear me okay?
Yes.
Yes.
Wonderful. Great. So yeah, good afternoon, everyone. It's a pleasure to join this important session on the strengthening the governance of health data and to really look at opportunities how we can advance this agenda in the lead up to and during the executive board meeting and World Health Assembly next year. So as Jai said, so Transform Health, we're a global coalition of organizations committed to achieving universal health coverage by 2030 by harnessing the potential of digital health and data. And as a coalition, and with our partners, we've been advocating for a global health data governance framework to improve the equitable governance of health data. And this has come about really just recognizing, as more and more our lives become increasingly digital and the amount of health data and health related data that it's collected and used continues to expand every day. And also with the COVID pandemic, we've seen even more how important health data is as a tool for strengthening health systems and responding to future health challenges. However, we've realized that a lot of the rules to govern the collection and use of data haven't necessarily kept pace with the growing demand and potential for data to not only support better health and well-being, but also to help reduce the potential risks arising from data misuse. And while a number of countries are instituting health data governance policies and principles, we found that there wasn't yet until the launch of the principles, a set of kind of globally comprehensive set of principles or a global framework to really guide the governance of health data across public health systems and policies. And we feel that global alignment would really help promote a common understanding of what health data governance should accomplish, an agreement and an understanding across countries and stakeholders to support more equitable and responsible health data management while helping to maximize public health value from data, but also really importantly, safeguarding data privacy, ownership, and rights. But we have seen there is a lot of growing consensus on the need for such a global framework, a global consensus. So many of you that might have been involved with the health data governance, the WHO Health Data Governance Summit last year, the outcome statement did call for a common framework and good data governance practices underpinned by a globally unifying set of principles. The Lancet FT Commission as well called for a new approach to the collection and use of data. The recent Broadband Commission's report on virtual health and care proposed a framework for policy maturity that includes clear data governance structures and standards. And then just last week, 2 weeks ago, a new UN article proposes an international data governance framework. So Transform Health, we've been working with our partners to help address this by calling for a global framework. So as Jai mentioned earlier on, as he was introducing me, so earlier this year, and as a key step towards a global framework, and what we see to really underpin its development, together with partners, we steward the development of a set of equity and rights-based health data governance principles, which were developed through a very inclusive and consultative multi-stakeholder process. This process was very specifically designed to make sure we were gathering perspectives and expertise, and really importantly, to ensure the meaningful engagement of a wide range of stakeholders from across geographies and sectors. So as part of this process, we carried out 8 global and regional workshops, which was followed by a 1-month public consultation on a draft set of principles. And this brought together over 200 contributors from more than 130 organizations across governments, international organizations, civil society, private sector, youth, among others, to really get that diverse set of expertise and inputs into the development of the principles. So they were launched earlier this year on World Health Day in April. And they really aim to align policymakers and other stakeholders as well around a shared vision for equitable health data governance, where all people and communities can share, use, and benefit from health data. So there are 8 principles, as you can see on the screen, and they're designed to really complement and reinforce one another, so they're not ordered in any sort of way. And they're clustered around 3 interconnected objectives, which balance both individual and collective perspectives under each of these objectives. So as you can see, the first set of principles is around protecting people, which considers the importance of both individual, group, and community data protections. The second cluster around promoting health value through data and innovative uses of data, so looking at collective needs and benefits of public health systems. And then the third cluster around prioritizing equity, so ensuring the equitable distribution of benefits that arise from the use of data in health systems, and that requires equity amongst both groups and individuals. And just to say, they do recognize and build on other existing norms and principles, guidelines, so they're not competing with it, but really we see them as strengthening the health data governance ecosystem. However, what's also really distinct about them is a number of elements. So both the kind of, as I discussed, the inclusive and consultative multi-stakeholder process through which they were developed, but also that they're applicable as well to a wide range of stakeholders. And then just in terms of their framing and content, that they really bring a strong human rights and equity lens to the use of data within and across health systems. And while they include core principles around protecting people, creating health value, they're also very forward-looking and looking at equity distributing the health benefits, and really have UHC, universal health coverage, at their core. So since they were launched, they've now been endorsed by over 120 organizations, ranging from global, regional, national organizations, and ranging across stakeholder groups, including academia, research institutes, international and national non-governmental organizations, foundations, private sector, regional networks, AeHIN amongst them, which is fantastic, and national institutes and professional associations. And while we continue to advocate for the principles to be endorsed by governments and organizations and for them to be integrated across policies and programs, we also really see the principles as a key step and contribution towards the development of a global health data governance framework and to really advocate for that global framework. So we are, as I mentioned when I started the presentation, we're calling for a global health data governance framework to be developed, adopted, and then domesticated by governments at national level. And to facilitate this, we really need and see governments needing to support and adopt a World Health Resolution, mandating the WHO to develop a global framework, and really see the World Health Assembly as a key opportunity to advance this, to get that kind of global buy-in from member states to initiate and kickstart the process for developing a global framework. We also see it's really important to ensure that any global framework is developed through a very transparent and inclusive multi-stakeholder process, including with the meaningful engagement of civil society and communities. And we really want to see the framework, as I said, we see the equity and rights-based principles that were launched earlier this year as a key contributor to a framework, and would ideally like to see them underpin such a framework to make sure that it does prioritize protection of people, promotion of health value, and equity. And then once a framework is developed, ultimately, we would ideally want to see it adopted by member states and then contextualized to national contexts, which of course that will look different in every country, but then domesticated through national regulation and legislation to ensure it is binding at the national level. And why we see the need for a framework and how we kind of envisage it, we see it as very much establishing an agreement between nations around a set of common standards for the governance of health data, which, as I said, countries would then, of course, that wouldn't look the same in every country. It would be contextualized to each country and adopted through national legislation, but it would provide that kind of global common set of standards, an agreement across countries of what that should look like. It would also lay the foundation for improved public trust in health data systems, where individuals feel protected, respected, and in control of their own data, but also allowing institutions working to protect the health and well-being of the population to access data and use it for the public good. Such a framework we also see as being based and building on a set of norms and standards which draw on existing duty obligations that countries have made to respect and protect, uphold basic rights as set out in different international treaties. And while broader data governance is really important, we do see that with the specific sensitivities around health data, this really warrants a need for a health-specific data governance framework to really maintain the health and well-being of both individuals and the wider population. And we do see that, a framework should really go beyond, while technical guidelines are, of course, very important, we really see a global framework as needing to fill this gap in terms of a focus on the regulatory environment and to ensure the necessary elements to help enable legislators to develop laws and regulations needed to govern the collection and ownership and use of data at national level. So in terms of, as we looked ahead towards the WHO Executive Board meeting in January and then the World Health Assembly in May, to ensure that this is discussed and discussion around a resolution to kick off the development of a global framework, we first and foremost really need to make sure that get health data governance on the official agenda. Also just realizing, as we've come out of the pandemic, but it was important even before that with the increased digitalization of health systems, it's really an important time to have that discussion through such a mechanism like the World Health Assembly, to have that discussion around health data governance and what's needed to really strengthen it as we move forward. So we really first and foremost want to get health data governance on the agenda at the Executive Board and the World Health Assembly, and then to table a resolution, get a resolution tabled to initiate the development of a global framework. So this is where we're really hoping that member states can support this agenda and recognize the importance of it to really drive and improve the equitable governance of health data by requesting WHO and the chair of the WHO Executive Board to help ensure that health data governance and a discussion on a resolution is on the agenda, and then to support and back a resolution that would call for the development of a framework, which I know the draft was shared with all of you ahead of this meeting. And while this draft, it's more to just have something on paper to stimulate that discussion amongst member states rather than being something set in stone. It's really much just to start the process and start that discussion amongst member states. And then we really encourage member states, as the WHO holds consultations with governments in the lead up to the Executive Board meeting around the agenda, to really actively participate in those, to continue to push for the inclusion of this agenda item at the board and the WHA. And then, of course, at those meetings themselves, so the Executive Board meeting happening late January, early February, if health data governance is not on the agenda for it at the Executive Board, there is an agenda item during the Executive Board where the World Health Assembly agenda is discussed. So we really encourage member states to then at that point to really speak up and encourage that there is an agenda item on health data governance then at the World Health Assembly in May. And then, of course, at the World Health Assembly to ideally really sponsor a resolution calling for the framework. And during these deliberations and discussions, we really encourage member states to help ensure that any global framework and any future discussion around that is aligned with equity and rights-based principles and is developed through a fully inclusive process. And just to finish off with one last slide, so just to flag, so while we really encourage member states to really support this agenda and help ensure that it's prioritized coming up to the executive board and WHA. There's also a lot of demand from the wider community for this. So just a couple of weeks ago, over 120 organizations signed on to a global letter supporting this call, which was also submitted to Dr. Tedros and the chair of the executive board, Dr. Petrich. And there's, by the day, the week, more organizations continue to sign on to this letter calling for this. And so we really hope that we can continue to build up the demand for this to be on the agenda across governments and across the wider stakeholder community. And we really hope a lot of you here today can help support this. Thank you very much.
Thank you, Kirsten. That was a very good recap of the evolution of the principles and then on to the implementation or the practice of the principles, and then AeHIN being with a mandate that we work together with the countries, the member states. And then so we thought, like, why not we engage with them as part of the general meeting today. So we have some of the countries here, and then we do have resource persons from those countries representing the ministries of health. And then we will have a presentation or sharing of insights from the health data landscape in those countries. And then we will also have a discussion on the draft resolution itself. So that is something that we have planned to have. And then I hand over the mic to my colleague, Dr. Fazilah, for the country interactions.
Thank you, Jai. A very good afternoon. I hope you had a good lunch. So we have started this workshop by presentation from Transform Health. So now we'll be followed by a presentation by 7 countries on their national health data governance landscape. And so we will start with the first country. So every country is given 7 minutes. So if possible, please keep to your time. So we'll start with Malaysia. I'll invite Dr. Ahmad Fali Siddiq from the Health Informatics Center, Planning Division, together with Dr. Muhammad Aizuddin from the NIH of Ministry of Health, Malaysia. Chai will be putting up the slides, or slides from here? Oh, it's here. Okay.
Okay. Thank you, Dr. Fazilah, fellow delegates and our partners. So today, I'm Dr. Hamad, and with me, my colleague, Dr. Aizuddin, will be presenting on the, we hope to give you a glimpse of what the health data governance landscape in Malaysia looks like. So before we go on to the health data governance, I'd like to talk a little bit about where we are in terms of our data availability. So we did a mock survey based on OECD's National Health Data Infrastructure and Governance Survey. We found that Malaysia actually stands quite a comfortable middle rank among OECD countries in terms of data availability. We're talking about national data sets. But of course, how do we govern this amount of data? So some of the major initiatives in establishing key national health data sets. So what we have now that is operational is the Malaysian Health Data Warehouse, which is a data warehouse built based on the Kimball approach that enables us to get granular data from various sources such as hospital information systems and clinical information systems from clinics and our patient registries. And we were able to analyze this data in a structured form and make it available for secondary use. and also realizing the importance of interoperability between systems as well as timely data and patients' longitudinal health records. We are moving towards the national HIE. So these are some of the areas that this presentation will cover. This is by no means a formal framework on data health governance that we practice in Malaysia, but it's just a common way of looking at data governance across industries, namely people, processes, technology. So in terms of the people, so for leadership, we have a CIO at the government level as well as at the ministerial level. And we have some committees that are responsible for approving, coordinating, and monitoring of ICT projects. Specific to health, we have the National Health Informatics Committee and Data and Information Governance Committee specifically for the Malaysian Health Data Warehouse that we are currently looking at expanding its role to actually include more health information systems. So in terms of the data access guideline for the Malaysian Health Data Warehouse, it identifies specifically the types of users, the defined roles, and the corresponding access levels for each of the user type. And then in terms of data ownership and stewardship, we specifically codify within our guideline for the handling and management of medical records for hospital and medical institutions that the physical records are owned by the institution, but the information contained in the documents are owned by patients, and this has significant impact on consent processes. And then we also appoint Data Steward, the Health Informatics Center, as a dedicated unit within the organization to manage and disseminate health data on behalf of our organization. So in terms of our processes, we have laws and regulations related to the collection and dissemination of health data. So, for example, the Act 342 that we used, it was in full steam when COVID really struck. So this grants the Ministry of Health the power to prescribe forms to be used under the Act. And then for Act 586, the Private Healthcare Facilities and Services Act grants the Ministry the power to demand statistics from private healthcare facilities on the diagnosis and treatment from private healthcare facilities. And we have a separate act called the Personal Data Protection Act that classifies health data as a sensitive personal data with subsequent implications on the way, on how it can be shared and the consent processes associated with processing and sharing of the data. In terms of strategic planning, we have a digitalization strategic plan. This occurs in 5-year cycles, which is currently in its 4th plan, and it lays out plans in domains such as applications, data, infrastructure, governance, and capacity. And some of the things that we've been doing the past few weeks. So in addition to our annual published indicators that the Health Informatics Center is responsible for, we are now moving towards catering to the data needs of the public as well as researchers. So we are making available some of this data on a portal called KKM Now, which is an open data portal hosted in GitHub. So over there, you'll find open data sets, nothing that's personally identifiable to patients, of course, but these are aggregated data that we've made available to the public and also to system developers should they require information from the Ministry of Health. So in terms of technology, in the Malaysian Health Data Warehouse, we have something called the Privacy Assurance Service, which takes care of pseudonymization of the data in MyHDW. So it enables us to longitudinally track the records within our data warehouse without exposing the personally identifiable information. So you can still do analysis such as readmission rates, etc., without actually knowing who the patients are. And then at the enterprise level, we adopt an EA approach in planning our health information systems to ensure that our digitalization investments align with our healthcare services. And this follows the government MyGov EA framework. In terms of our standards, we implement data standards such as identifier standards and semantic standards, as well as at the interoperability layer, we adopt at the national level syntactic standards to ensure that the systems are able to exchange data in meaningful ways with one another. So for the next part, I will pass it on to my colleague, Dr. Allaudin.
Yes, okay. Thank you, Dr. Ahmad. So for my part, my job description is mainly doing clinical research and clinical trials. So we adopt the previous standards mentioned, and we also some principle for us. One of them is a good clinical practice guideline. These are mainly trials and any interventional studies, and we also have guideline conducting research within Ministry of Health. I'm going to describe a bit of use case. We are doing a primary data collection at this point. So these are real-time monitoring health data for patients within quarantine center. So what happened is all patients are prescribed, subjects are prescribed with this IoTs, and then we have mobile phone that collects all the information. So at that point, we were thinking that maybe we can have certain level of encryption, where we're saying that site level encryption, device level encryption, and cloud level encryption. We just want to test whether, where can this bring us to, whether it's gonna make our life easier and patients' life easier. So we did have biosensors, mobile, and health dashboard at the end. What happened is from the site level encryption, we contribute data from IoT devices and then some patient information. But at that point of time, we already anonymized the data, so it doesn't really pose significant danger to patients or data leakage and things like that. These are the process. We registered, send data, and transmit and reviews accordingly. We conducted this study is during the second wave of COVID-19 in Malaysia. It's done in our health facilities. We have a high success rate of data captures, and it's also very useful for clinicians. So these are the process flow. There are three parts where we did the encryption. Sorry, let me change the laser pointer. This is one, and then two within the device itself, and then we did have a separate cloud ID for each patient and each center. The one that I would demonstrate earlier on is just one center, but we do have other centers as well. Yeah, so I think that's all from my part.
Thank you, Malaysia. Now we will go to India first, as Prof. Agrawal has to leave. For India, we have two speakers, Ms. Manisha Mantri from the project lead for the National Resource Center for EHR Standards, and also Prof. Anurag Agrawal. So both are with us virtually. So Ms. Manisha, you can start first.
Sure. Thank you so much for calling me on this panel discussion. And this is indeed a very interesting topic and a topic of importance for India as a country, and I guess for everyone over here. So I'll speak a little about what is happening in India on the data governance side and what's being going on. So based on the National Health Policy 2017, India is focused on the WHO SDG for universal health coverage, and there are several steps already taken towards that. So the first and foremost step that was taken is of having the Ayushman Bharat health insurance scheme. So it's a national public health insurance fund of Government of India, and it aims to provide free access to the low-income earners in the country. So that's an immense major step, and being accredited as one of the largest insurance scheme run by government worldwide. The scheme is currently fully functional, and we have around 32,000 admissions happening every day. And until now, over 30 million admissions are already taken place under this insurance scheme. So you can imagine the amount of data being generated and the amount of patients treatment being happening. The another program which is very important and was a big step towards digital health journey of India was the Ayushman Bharat Digital Mission. It's again a national digital health mission, and this mission aims to kind of create a necessary whole backbone for the digital health infrastructure in our country, and it has multiple key building blocks of the digital health enterprise architecture. It follows the open architecture mechanism for creating various building blocks, and the building blocks which are already developed and are functional include patient registries for patient, for healthcare providers, for health facilities. Other than that, the major and the important building block being health information exchange, the interoperability standards being adopted, FHIR being the standard for data structure for data exchange, and the other core terminology and coding systems being already adopted under this health mission. And other than that, there is something called universal health interface, which enables various health service providers to develop digital services, healthcare services over these all building blocks. So ultimately, the ABDM paves the ways to improve public health and also respond to the health emergencies and ultimately reach the SDG goal towards UHC, universal health coverage. So while we are moving with increasingly with digital and so much of data getting generated, the amount of health data and health interventions happening, data being at the center, it is very, very important to have the appropriate governance policies around the data. And NHA, the National Health Authorities, is very, very sensitive towards managing health data for patients. And the agency works in a very agile manner where the policies are being managed and developed as we are learning through this implementation of ABDM. So towards data management, I would say there are three key aspects that the National Health Authorities is looking for ABDM implementation. One, first and foremost, is decentralization of data. So we do not have one single central repository kind of for data. So the data is stored at the health information provider sites, and whenever required and requested, the data is being shared between the health system through the interoperable standards. The second key aspect to look into is that the NHA has published the health data management policy, which is also updated from time to time based on the feedback and the learnings that are happening over the time, the way the digital mission is being implemented. So this policy is a guidance document, and it says sets out a minimal standard for data management, data protection that should be followed by each and every participant and stakeholder in the whole digital health ecosystem. So the policy is being implemented in NDHM and is being adopted. Now, the third and the important part in the whole ABDM ecosystem, and which is foremost at the center of the health information exchange, is the consent manager. So in the whole National Digital Health Mission, there is something called consent manager is one of the strong building block where all the data that is being shared, transferred between different entity over the whole network is being managed by this consent manager, and no data is being exchanged without having the consent from the patient. So this consent manager is also developed referring to ISO 17975 standard, and also using the electronic consent management framework, which is developed by the Ministry of IT for all the e-governance solutions in the country. So that way, the consent management is also being homogenized, not only in the health sector, but the other sectors as well. I would lastly would say that India is also due for developing or coming up with a very strong person data protection bill, which is in discussion right now. And I hope when this bill comes in, we have more clearer, transparent, and stringent data management policies being implemented in the country. And I would like to hand over to Anurag, Professor Anurag, who is there with us.
Thank you very much. Amplify a few points. The first of which is that you have to invest in creating digitally enabled services. You have to invest in creating digitally enabled citizens. You have to create an insurance system in which the citizens can take benefit of the services. And last, you need to have a governance framework of the data. Where India has done very well is in making sure that all these four pillars are in place. And the concept of digital public good in health is very clearly articulated. There are, of course, miles to go in terms of scaling this to the point that high quality healthcare is available to every citizen. And I'm not going to say that anybody is 100% there yet. But we saw the first example of this during the massive vaccination rollout in this country. When everybody received their vaccination, 2 billion vaccine doses have been given. Everybody received that vaccination through this digital framework called CoWIN, built in an open source mode. All data of every citizens, including digital cards and fully secured information is there. One area where I would like to see further growth, and this is partly technology, you can have the approach of consent-based architectures in which patients give consent for the use of their data. It is my observation over time that consent is something that is a short form for informed consent, and that informed is a very, very tricky business in the area of all health data. Alternative approaches that India is looking at include mechanisms in which data does not have to move at all, but algorithms can move. Privacy preserving architectures can be used in place of simply taking consent for use. I think these are very, very hot, very difficult, but very important areas that all of us globally must work together, particularly using open science, open data. Thank you all.
We will now have the presentation from the Philippines, Ms. Charity and Leah.
Hello, yeah, thank you. So the Philippine health data governance landscape. There's a saying that if you want to go fast, you go alone. Diba? It's an old African saying, but if you want to go far, you go together. And this is exactly the mindset a decade ago of the prime movers of e-health in Philippines. Namely, I think, they're all in this room. The Department of Health, the PCHRD, the Academe, the ICT, and others. What they did was they crafted a joint governance policy, the primary intent of which was to achieve synergy in the development and implementation to ensure adoption, harmonization, alignment, and interoperability among various e-health initiatives in the country. And this led to the creation of a multi-agency governance committee for e-health. And to this day, it still exists. And central to this effort is the robust collaboration and partnership among the various public and private sectors in healthcare and ICT. Next, please. The situationer. You can say that managing e-health is like herding cats, no? Ang hirap. It requires a great deal of effort to realize. To date, some of the challenges facing the e-health governance team are the following. Number one, inconsistent data collection. Is it also true for some of our neighbors? The country has multiple data sources such as disease registries serving a specific purpose. DOH would have its own registry, and specialty societies would also have their own registries. DOH and international partners and other health-related entities would also be processing their own data. I think this was also mentioned earlier by Dr. Chancellor. So we're not alone in this. And the presence of various non-interoperable systems which use different technology and platforms, solutions, standards, and structures are also used by the different health facilities and implemented by different health programs at the national, regional, and local levels. We also have an absence of functional integration platform to harmonize data management of the health sector. Overall, this fragmentation, lack of standardization, and absence of seamless health information exchange and reporting deter and render healthcare services and delivery ineffective. Not really ineffective, but not that efficient. Making the reports generated not reliable for meaningful interpretation and decision making for public health interventions. Next, please. And as we all know, 2 years ago, COVID-19 happened. And in the past 2 years, when COVID hit us, our major gaps were exposed. There was weak data governance. For those who are here, just remember COVID Kaya, our big problem with COVID Kaya, and our big problem with, we also had major issues with our vaccination databases. We did not have a unified data management architecture. We had an inadequate data management infrastructure. And we had so many data management policies, but we were also a bit weak in enforcing these policies. And what more, we had a lack of human resources needed to implement all these data management activities. Next, please. But everything changed. Nowadays, everything has changed because we have these MP2s. We have now the new normal, that's the reason why everybody is here in this beautiful hotel, because COVID is beyond us, knock on wood. We also have a UHC Act, which was implemented, which was ratified just before the pandemic, and we started implementing it in 2019. But again, unfortunately, COVID happened, and now we are raring to go. So, in short, we are fast-tracking work on data management. This year, we are crafting our data management framework so that we can align everything and for a more efficient and effective implementation of our data management. So that we will have guidance in our data management journey. And the key milestones in the short term are the following. We need to initiate steps for data governance mechanism. We need to improve our data metadata. We need to develop risk registries. Risk registries, data architecture, and where else? And improve our data quality framework. So that is for the um, short term. In the medium term, we will strengthen the data management mechanism, adopt DOH data architecture, and make sure that we have our quality assurance framework. All these activities should result in an authoritative and good quality data sources so that so that there will no longer be data disputes, because sa ngayon, as we all know, there are so many data disputes. In the past year, there was data dispute almost was a data occurrence, because, like, for example, DOH would say, aha, this particular city has so many COVID cases. And this particular city would say, no, DOH, you are wrong. We only have this much COVID cases, not the many that you said. So those kinds of data disputes. So if we have good data management, no such thing should happen. Okay? So these are the things that we need to develop, so that, like, for example, if we say, aha, we have so many private hospitals in Manila, and then DOH would say, oh, Manila, you only have so many private hospitals with this particular, like, specialty. Okay? So there should no longer be any dispute between DOH and the other and the private sector or the specialty societies if we have good data management. And that is what we are striving for. At the end of the day, our long-term goal would be that DOH would really have, that reports will really be integrated and done centrally. Okay. And okay. So, and data will really be integrated, and information at our fingertips will be really possible. Thank you very much.
Thank you. Thank you, Ms. Can. Thank you for sharing the health data landscape in the Philippines. Now we will next have from Maldives. I invite Ms. Aisa Samia. She is the Permanent Secretary, Executive Bureau from the Ministry of Health, Maldives. Sami, over to you.
Thank you, Jay. So in this presentation, I would give a brief, I would say a brief introduction to our national health data governance. Presentation would cover these areas. So health data governance structure in the Maldives, the legislation, the policies, the standards that we have, also the work in progress, so that I could share what we planned in the coming years. Overall objective of our health data governance in the Maldives is the administration of data to ensure availability, integrity, quality, usability, and security. At the top, we've got the Ministry of Health. We've got Health Services Act, which mandates Ministry of Health to develop a health information system in the country. And in the Health Services Act, it states that the health system includes private, public. So every entity that provides healthcare in the country, even if it's like voluntary or through the UN agency or through the private, this is covered in the health system in the country. And Ministry of Health has the mandate to ensure that we collect the data. There's a minimum data set that the data flows through one system. Just to give how the information flows in the country. So at the very ground level, we've got health centers. So as a policy, in each inhabited island, we would have a government health facility. So data flows from the ground level at the health center level. It goes to the atoll level. So atolls in Maldives would be like group of islands together. So at the island level, we have the health centers. The health centers would report to the atoll level. Data flows also through the same process. And then the private hospitals would be, and clinics would be in any island, but most would be in the central level. So the data flows from the private facilities or private clinics. And then there's also the social health insurance system. The social insurance system covers all the citizens in the country. Everybody is covered, and then they also collect information. So information flows from the private pharmacies, from the private hospitals, from the government hospitals, and even the insurance pools the data for the healthcare that happens abroad or in other countries. So all the data flows to the Ministry of Health. But our main issue is that the data, there's not one system that collects data throughout the country. So we've got like many different systems. We've got digital systems, different digital systems at program level. We've also got manual flow of data. So some of the digital system that we currently use, DHIS2 is used widely. There's monthly data that flows from the health centers from the atoll hospitals to the Ministry of Health. So we use DHIS2 to collect data like the outpatient numbers, inpatient numbers, bed numbers, human resource numbers that flows through the DHIS2 system to the Ministry of Health. Recently, we also introduced a national digital vaccination registry. Very recently, actually the launching ceremony was 1 week ago, but the team was working on this like for many months. So there's one digital vaccination record across the country, let it be like private or public, so that the information flows, even if the baby gets the vaccination at different facilities, the information flows into one pool. The second phase of this, the digital registry, vaccination registry, would be a parent portal where the parent gets information, access of their children, and then it also reminds, so sends a reminder SMS to the parent's phone, mobile phone that's registered. Then there's also data security that goes at the back end of the system, so that we get support from the public and trust from the public for the system. The government system that you see just beneath the DHIS2 is the birth and death, National Birth and Death Registration System. Again, this connects the Department of National Registration, the Ministry of Health, the facilities, private and public, as well as the island councils, so that everybody gets the same data, but then there's different access controlled for different users at different levels. The third one, SIDA system, is again a national system whereby all the communicable diseases reporting happens through the same system, and Ministry of Health and Health Protection Agency gets daily information of all the communicable diseases that are in the reportable diseases list. There's different facility level systems. Some systems are very advanced, like the tertiary hospitals have systems that collect information like for all the operational aspects as well as the patient care aspects. But some of the other systems like at the island level or atoll system wouldn't be so advanced. The ASANDA system is the health insurance system. This also connects all the different levels. But you can see that all these people has to enter data, or staff has to enter data into each of these systems. That means there's lots of duplication of data, and the staff, especially at the island level, are overburdened entering data into the different systems. Now, if these systems were talking to each other, it would be like less work for the staff, especially at the ground level. I'll just move on to the regulation, the legislation, the policies, and the guidance that we have nationally. So we've got our Health Services Act, which I mentioned before. We've got a National Birth and Death Act, which also mandates reporting. And the birth is actually tied with the school admission, so that everybody gets the registration done The death registration is again linked with burial. So again, it's additional impetus to ensure that we have good birth and death registration. We've got a health information system regulation. I saw in one of the other presentation as well. So under the regulation, the information that's created in the facilities own the record, but the information is for the patient. We've got the medical record regulation. It has informed consent. It has the information that needs to be there in a medical record, many other aspects. The health research regulation. On the right side, we've got the guidelines that we have, including the statistical guideline and the data release policy. So anybody can request for data in the country if they request through this process. So the next steps, just this slide. We are working on the health, digital health strategy and standardization process with WHO. Currently, the health information system evaluation is ongoing. After that, we would move on to the health information system mapping and digital health architecture blueprint. So it's already in process. We would have the blueprint by next year. We're also working on the health information bill. So the Health Services Act, which we follow, only covers the information that's generated when there's a health service. We feel we should have a more comprehensive bill which covers information that's generated beyond health services as well. So the health information bill would be much stronger. We would have a commissioner for health information. There would be like specific requirements to report the data. So there's a lot more in the Information Act. Thank you.
Thank you, Sami, for the comprehensive landscape from Maldives. Now we will have Sri Lanka sharing their health data landscape. And then we have Dr. Palita Karunapema, who is the Director of Health Information, as well as Dr. Hasita, who is the Program Coordinator for Digital Health Blueprint Development from the Health Information Unit, Ministry of Health, Sri Lanka. Now over to you, Hasita, for the health data landscape presentation. Thank you.
Thank you, Jay, and good afternoon, everyone. I'm Dr. Hasita Pramod, Health Informatician from Health Information Unit, Sri Lanka, Ministry of Health. Yeah. So I would give a brief context of the health data governance in Sri Lanka. So in the background, as you can see, why we need the health data governance, the importance of health data governance. As you see, there are so many systems running in Sri Lanka at the moment, mainly curative sector, preventive sector, and human resource management systems as extra. So basically in Sri Lanka, we have three key health information management systems, which are called as HHIMS, HIMS, and currently we are in process of developing open MRS system, and we have a cloud HIMS. Apart from that, there are so many DHIS2 based, mainly the DHIS2 based systems, which are in our campaigns. There are around 20 campaigns which were running in Sri Lanka. And we have a very good EMMR system, which connect more than 600 hospitals in Sri Lanka. We get the accurate data from that system. And the hospital systems, which including the PAC systems, laboratory management systems, OPD, ward modules, as well as other clinic modules. And with the COVID situation, we are capable of developing COVID systems, which were mainly based on the DHIS2 systems and the health COVID immunization tracker and vaccine certificate, which was very successful health information interventions. So in Sri Lanka, it's just a brief detail. We have around 22 million population, and as you already mentioned, preventive and curative health sector services, and under the 9 provincial ministries of health, we have 354 MOH administrative areas related to the health, and we have workforce around 140,000 medical personnel. So our goals to strengthen the health delivery and deliver the accessible and quality curative care and promote equitable accesses, ensure comprehensive health system to develop strategic partnership with all the providers. So this is a basic business patterns. We are working in the healthcare in Sri Lanka. The Ministry of Health and the government with funding from the government, and this under the Ministry of Health there are several health authorities. They are the one who planning and the resource handling the things, and the clients get all the benefits. That benefits is again go through the government. Yeah. So this is the our health ministry organization. It's under the Ministry of Health and the deputy minister or a state minister, and the Secretary of Health. There are and the Director General of Health Services under several DDGs and the directors. So the baseline business architecture, as you see, the government, the Ministry of Health, and the Health Information Unit, which is the key coordinating unit in the health information at the Ministry of Health. So there is a e-health steering committee, which including the Secretary of Ministry of Health, which is the main governing component as the government. And as you see, the capabilities with the digital capabilities and the human capabilities, then the digital capabilities is the key component which covers under the health information unit. So we are working to develop this component. I will give an overview of our proposed next architecture in my incoming slide. So as I mentioned, as you can see, there are a lot of systems we are currently running in Sri Lanka. So then we came to the data governance. So why we need the data governance? As I mentioned earlier, the data governance is very important with the expansion of the digital health context in any country. Because when we are having a increased number of digital health systems, which was very important to having a governance. Otherwise, that data, the quality and accuracy, and the use of data is not useful. Otherwise, we don't have any data governance. So that would be a key pillar of data and analytics strategy with the data governance. So I basically use the health data governance principles to elaborate what in our country's landscape we are aligning with the data health governance principles. So with governance help, how the data governance help in digital health. So it will help us to define and approve the communication data strategies, and it will provide a single stream of record of data. It's a national NEHR we are on the process of developing, and enable conformance of data policy standards, which I going to present in incoming slides, and how we create accountability and connectivity and use of consistent frameworks and maintain momentum to data-driven digital economy. So in under the protect people, the security. So in Sri Lanka, we already developed the National Digital Health Guidelines and Standards version 2.0, and we are having information security guideline for the healthcare. Those two guidelines and standard we issued from the Health Information Unit. Okay, I will I had to rush because the time. Yeah. All right. Yeah. Yeah. So and we are having our SL cert that was the key security body which is confine and checking the security of the any health system, which was before implementing. We go through the SL cert security assessment to protect the personalized data which was included in that health information system. And we are having the Right to Information Act, which will provide the data ownership, and it implies the individuals and communities have a right to know their own data. And I have very proud to announce that we have our Personal Data Protection Act, which was the Sri Lanka has become the first one in the South Asian region to pass the Comprehensive Data Protection Act. So it basically include all the things, including in how we going with the personal data protections. So, and finally, how they promote the health value. So we are in possession of developed the Sri Lanka Digital Health Blueprint version 1.0B. Last week we released that version to the broader stakeholder review in Sri Lanka to get the most review to complete the version 2. So this was the proposed business architecture, which I was mentioned earlier. This was the latest one with the blueprint. So this is the how we evaluate our blueprint. So we initially go through all the documentation what we already have, and standards and guidelines and all the stakeholder engagement. So with the helpment and the government principles, so we developed the Digital Health Blueprint version 1.0B, and next version would be with the final version with the change management and process governance and the implementation and realization framework. And there is a finally all the frameworks. Yeah. So thank you.
Thank you. Thank you, Dr. Hasita, for the sharing from the Ministry of Health, Sri Lanka. Now we have Mr. Setyaji, who is the Chief of Digital Transformation Office, Ministry of Health, Indonesia, joining us virtually. Welcome you, Mr. Setyaji, to share the health data governance landscape from Indonesia. Over to you. Thank you.
Thank you. Yeah, thank you. I will, excuse me, maybe I will share my own slide. Yeah, thank you for having me today. Sorry, apologize to cannot join today offline. Yeah, talking about the data governance and etc. This is our dream in futures. We want not only gather the data coming from citizens from earlier of life, but also we want to connect with the health facility for physically and also in virtual, and also connect with the IoT and also wearable device. Yeah, but for that, this is the situation what we face today. We have actually more than 270 million Indonesians live in more than 17,000 spread in these islands. And we have more than 60,000 healthcare facility to integrate it with this health facility. And then also more than 400 applications already now built by Ministry of Health and also other regional. And we have some issue about the unstandardized and also the scattered data, and also hard to do interoperability and integration in the national scale. Because of that, we already planned digital health transformation roadmap, and we have already blueprints in 2021, and we have some roadmap until 2024. So last year, parallel with the fight COVID-19 using the IT, and also we launched these blueprints, and we put some standards, not only the platform but also the architectures of the data itself. And then in this year, we already launched the health information exchange or health information system to connect with the 60,000 health facility. And then also we built the standardizations and also the regulation to support this issue. Yeah, this is our platform. We call this Satu Sehat. This is the Indonesian Health Services. We'll be connect with the 60,000 health facility, mostly coming from the pharmacies. And this year we start to test this platform, and now more than 70 health facility already connect with us. And our target in this year is more than 12,000 will be connect in end of this year. And this platform not only connect with the health facility, but also in our application. We call this Peduli Lindungi. Actually, before this application is only for COVID-19. So with these applications, the people can access their health personal medical records. Actually, this Peduli Lindungi now already downloaded more than 100 million people in Indonesia, and every day used by 8 million people use this. Because of that, we use this platform to connect with the health facility, and also other disease can input in this our applications. Yeah, this is our conceptual of the how we connect and also how we manage this data. This is the data architecture already built in our platform. So we will connect with the primary care, secondary care, etc. using the FIRs. And also we use some standard like SNOMEDs, logins, and so on. And this data can not only have some user consent, secure data collection, and also ensure data quality, availability, and accessibility, and also transparency. So the data not only is for us, but also to regional university to use not only for research, but also some analytics, yeah, to improve our health capacity. And this is the standard already built in our platform. Not only we built the master patient index, but also the health facilities data or reference. And also we fix and also to build the master data of human resources of our health workers. And also the dictionary for the medical devices, and also the medicines, what we call the KFA dictionary, and also services data using SNOMED, ICD-10, and logins, and so on. And after connect with this platform, the region, the national level, and also some parties can access their data, and also the people itself, and some applications connect with this platform. For example, we have more than 20 startup health tech, so they can connect also with this platform, and then they can share their data to its health facility, and then we can build the analytic on top of this data. And then this is the regulation already support to these EMR implementations. So we renew some regulations to support this initiative. Not only we have this regulation, but also some regulation coming from the national level, like personal data protections, the freedom of information, and also the security, and some of support for the implementation this healthcare data. Yeah, this is some new regulations already have to support this kind of implementations. Not only we give some mandatory to all the health facility to implement this electronic medical record, and also need to integrate it with our platform Satu Sehat. And also we push all health facility to use our standard, and also how we can process their data, the citizen data, to improve our program of the health resilient in the futures. And also some reference for the health facility, for example, like reference and etc. Yeah, this is our short brief information about the plan, and also what we are doing now to integrate it, and also to concern about the data governance in the health sector. Thank you.
Thank you, Mr. Setia-ji, for being with us virtually. And then we have the pleasure of in fact, Dr. Rudy and Anis here joining us. It would have been fantastic to have you in person, but Thanks for taking time from your busy schedule and then joining us virtually and then sharing the health data governance landscape from Indonesia. Now we will move over to the open discussions, and then whoever is staying online, please continue to be with us for the open discussions. That will be very helpful. Over to you, Dr. Fazilah.
Thank you, Jai. So now we have heard from 7 countries on their country landscape. And as you know, COVID-19 has actually enforced the importance of data. But at the same time, it has also exposed many gaps in terms of data governance, data management, digital divide, and also inequality. So this global framework that was presented earlier by Transform Health, which is very inclusive and also consultative, underpinned by human rights-based and equity-focused health data governance principles. So if I just summarize it, it's on 8 principles, talking about protecting the people, promote health value, and also prioritize equity. So now I would like to open for an open discussion before we go into the resolution that is going to be brought forward, is planned to be brought forward to the World Health Assembly next year. So this will be, the workshop now will be on the health data governance principles, the 8 principles. And so I'll be asking country by country, but my focus will be maybe those who have not spoken today. So the questions will be around, do you think these are already addressed in your country, the 8 principles? Which principles you think can be adapted easily in your country? And which principle will have challenges in your country's context? So now I'm going to open this for a discussion among these 3. So first, who would like to volunteer before I actually call? Anyone who would like to volunteer first? Malaysia has spoken. Volunteer first, then I will call. Perhaps Nepal. Yes, the mic is there. There's a mic there. Is there a mic going around? And there's also a mic there. And I think we can also have a mic. We'll also have a mic going around. Yes. Yeah, it's open.
Thank you. Especially in my country, Nepal, we have the very good legal framework. Especially our government passed and approved the IT-related policy and strategy we have. And recently, just two and 3 months ago, government, especially Minister of Health and Population, approved the roadmap of AeHIN. It's a very long-term policy documents. It's 2022-2030. That is legal background we have right now. But some of the clarities should be cleared. The role of the Minister of Health and Population and the Department of Health Services, we have to just distinguish our role and responsibility between the department and the ministry. We are planning in that way. But regarding the information system, still we have the very good information systems. After the federalism, now we have the 7 provinces and then 753 LLG, local level governments, all are functioning right now. And we have collect all the information, even from the lower level of the health facilities under the LLG. So that is in our systems. So every month we collect all the information from the local levels, and then province level also see all the information from their respected local levels. So we have the very good networks, and even we have the 52,000 female health volunteer workers who are working in the ward levels. Even they report to the health facilities, and then health facility report to our systems. And if you look all together, it's around the 9,300 plus. Every health facility report to our DHIS2 platforms. So that is a very good part to us. And if you see that in terms of numbers, 1/3 of the health facility directly report to our DHIS2 platforms. Remaining 2/3 are report to the Palika levels, LLG levels, and LLG levels just entered their report to DHIS2. So the system is very good.
Very good.
Yes, network system is very good. And I also look the logistic management information systems. It is also in good place. Regarding the especially some ICT related activities, we have to do some things.
Okay.
That is the main things I
Okay.
can share to you.
All right. Thank you. But in terms of the 8 principles, I think these principles are universal. So perhaps whether Nepal will go into adopting or adapting these principles for a better governance, so that can also be looked at. And maybe perhaps when we go into the resolution later, then we can see what we can adapt and adopt.
Yeah.
Thank you, sir.
Thank you.
So next I'll go maybe Fadli. Is there anything you want to say about adopting the 8 principles? What challenges do you see, or you think these are, it's easy to be adopted, or can it be adapted to the country?
I think in terms of this 8 health data governance, this is good because it can be a guideline. Because one thing is, it is good if we have it is in place, but it is also good when we have it in the proper documentation so that it can be passed on to become legacies and all. And it's also good when it is properly documented. Then whenever we want to have another systems or another projects, we know what kind of guideline we should be in place. And after we have that, the proper documentations, then it's also good in terms of we want to further spread the awareness of the proper governance. And then from the guidelines, we can go toward the legislations and all. So it is good that we have some guidelines to follow on. Yeah.
Thank you. Thanks. Maybe Jovi. Just now, Ms. Charity presented that Philippines is already developing a global, data governance framework. So do you think this, the one that's presented by Transform Health, can be adapted and adopted to your governance framework?
Hello. Yeah, although we have some initiatives and works already, I think these principles will also be very useful on our side, for the reason that though we have existing, we can always check and validate. And whatever the missing or the gaps be, we can accordingly apply that or strengthen what we have right now.
Okay, great. Thank you, Jovi. And I think just now Sri Lanka presented, they mapped it to the Transform Health principles. I think that was very good for each of the principle, what is being done in Sri Lanka. So perhaps that is one way we can look at that. So maybe I would like to ask Pak Anis is here. If there anything you would like to add in terms of the challenges in adopting this guideline, in the principles?
This 8th principle is a very universal and relevant for all people in the world, and also for Indonesia. When we are talking about universal health coverage, in which we are talking about the 3 axes: the increasing coverage, increasing the services, and also the financial protection. I think Indonesia still have a big homework to achieve that. And adopting these 8 principles will be very important to ensure that increasing coverage could also include the process to develop innovation, but on the same way, still maintaining the ethical process on collecting the data, and later on bring the value of the population with the universal health coverage. So I think we need to combine with the principle of universal health coverage into that kind of data governance principle. Thank you.
Thank you, Pak Anis. But those who are online, if you like to also give comment on the chat, we can have the secretariat to read those comments. Yeah. So now maybe Hong Kong, if Klube would like to say something, yes. And then we have Japan here. I thought we had, no? Okay, Hong Kong. Thailand, boss, I will not forget. I'll come to you. Yes, Klube.
Hello. Yeah.
Yes.
I agree that the H principles also already implemented in Hong Kong, but the most challenge is about the promote the benefit of the health data, including the some incentive about how to encourage the citizen to share the data and doctors to ask them to share the data to the government. It's the most challenging. So I think overall the data governance is good, but we need some business model to mature the framework.
Okay.
Yeah.
And I think also the implement the principles can be there, but whether we can implement it's another big thing. So Bunchai, Thailand, if you like to say something.
I don't quite sure that I can say as the country as a whole, but in terms of the individual, the principle is kind of like Anis says, it's universal, and it hard to not adopt. You know, it's hard to not adopt this. The challenge is like our friend in many countries, how to operationalize it as when we practice it. And I think every country, include Thailand, also would like to achieve all of these 8 principles. The challenge is that it's not easy to achieve that. You know, as a principle, this is, I think, it's really hard for individual or the government to deny this, but to make it happen is another issue. Another one thing that I think next step that we should do as the health IT or informatics community is that this is more kind of the abstract thing. How we gonna be like Ube said, what is the use case? What is the Fendi said that how can we have a documentation or the good practice that we can do this, implement this, and then compile or adopt this principle. That's what I think every country should adopt it, and should be adopted by the WHO. Thank you.
Okay, thank you. Actually, if you look into the principles, I think most of the principles are already being adopted. But I just would like to know if any country would like to comment about establishing data rights and ownership. How are we going to do that? Anyone? Sri Lanka? I think just now you were mapping one of it. So could you explain what do you mean by establishing data rights and ownership, and how are you doing that? I think that is one of the most difficult principles here.
Yeah, that is mainly came under the Data Protection Act for any country. I heard there are so many countries in the process of developing Data Protection Act, which including those components. So many countries already having their bills there, and still they are revolutioning to become a act. So Sri Lanka, we came into a point to develop an act. So those through the act, the components which is not limited to the digital health, as well as to the other components also, which include in the how we establish the data rights of the individual person. So that is very important. So we can reflect to digital health interventions through the referring the act. So digital health interventions, we can clearly confined, or we can clearly mention what are the steps that we are taken into when we are developing any system. These steps must have to be done before the implementation of the system. So that's the way we can do the data rights and data ownership of any system in the country.
All right. Thank you.
Hasita, I just want to have one remark. Now that Sri Lanka is involved with digital health blueprint development, so where do you think, going forward, if you want to sort of incorporate these principles, So how do you think, like, what is the process involved? Because everyone, like Dr. Bunchai highlighted, like no one probably will conflict that these principles are not possible or not required. Like everyone would like to follow, but then like, how do we actually as a country move forward? Because that is one of the objectives of this workshop. Like, what is the process that you see? Because I'm asking this question in specific to Sri Lanka because you have the blueprint almost out. Yeah.
So under the blueprint, there is a legislation. We are having a chapter called legislation. So in that component, there is a governance. So the governance, not only the data governance, there are IT governance and infrastructure governance. There are 3 components under the governance. So under the data governance, we can adhere these principles by mentioning in the digital health blueprint how under the principles, these are the measures and rules and regulations which will act under in Sri Lankan context, how we are going to plan.
Oh.
Okay.
Small addition to that, I think with the blueprint, when we operationalize the things, probably under each different scenarios, probably we need more detail, kind of a, maybe it's not maybe a checklist, but something like that to
or action plan.
Some kind of a prioritized actions under each domain.
All right, thank you. Mongolia? Yes, Dr.
Yeah, in our case, last year our parliament approved 3 main laws in terms of data. The one is the personal data protection law. Second one is data security law, and third one is the personal digital signature law. And I think in our country that we have all legal environment is actually quite good, but the implementation period it's quite difficult to how to implement this law on site. And I fully agree with Bunchai's comment and opinion. It's easy to improve and develop this kind of law and legal environment on the paper, but in reality, it's quite difficult, I think.
Thank you. So maybe some of our development partners, if Merrick or Sean or USA.
So I think that what's exciting to hear about all of this from my perspective is thinking about that relationship between the principles, the regulations, and the action plans. And I think it's going to take pieces of all of that to come together. And I think USAID themselves participated in the creation of these principles is something we're strongly supportive of. But I think we need that strong signal for government of how that is going to come and happen within your country context. And then we can work to make sure that our programs and our investments that we are making to help support health outcomes align with that. So I think I really appreciate hearing the way that you're thinking about bringing these to life, and which ones will be hard, which ones will be easy, which ones already make sense in your context. And then I think communicating that out clearly and widely and publicly to the development partners as well as everyone else will then enable us to relate that back to the investments that we're making. Thank you.
Thank you, Barry. Alvin, you have something to say? Alvin and then Charity.
Charity, you want to go first? Charity.
Charity, yeah.
Because you know what, all those 8 principles are very, very good, but operationalizing those are, oh my God, I don't know if that's even possible. So, like for example, we were looking at what's that? Yung patient slide. The protection of person and communities, that's one very, very challenging statement, I think. And the other one,
maybe the rights
and promote and no, that's not establishing data rights and ownership is I think a given, but what's the other one? Build trust in data systems is another big challenge that I think, but I think the challenge is not insurmountable, because maybe if development partners can make concrete I don't know. Ways and means how to overcome all this. Maybe the governments will adapt them.
All right, thank you. So the final word from Alvin before we go into the resolution.
Dr. Chansley, yes. You traveled along.
And
way,
Dr.
so
Chansley,
you
yeah,
talk first.
sorry for a lot, Laos.
Thank you. Because we know that there's no doubt to agree on this principle, but in order to know each country where they are now, so why don't we put the egg principle and make a survey or assessment where the countries stand now? In order to invest in this, you need to know in egg principle where which country they are now. Thank you.
That's a good idea, and also not only maybe also whether if countries would like to, adapt, not adopt totally, and to their own context can also be done if we can do a survey. Alvin, you have anything?
Yeah, I'd like to take the educator's perspective. So I agree with Charity. The 8 principles are easy to accept because they're really very good motherhood statements that we were taught when we were growing up, but they're hard to do. And when you get into that situation where it's easy to accept but hard to do, that's when you start teaching it to the students and then giving them real cases where they will start looking at this motherhood statement in practice, the way they write the electronic medical record, the way they write on the paper chart, the way they manage their USB drives, the way they talk to the patient, and how they get consent from the patient for things that are very sensitive when they need to make records about it. So I think we need to start young. I think the motherhood statements need to be converted into practice. And I think that's where we need to go forward. I mean, when we go to the forum on the resolution. So just a plug that this Saturday, the Philippine Society for Digital Health is organizing a webinar on integrating the health data governance principles into health education in the Philippines.
Oh, that's
so,
great.
Yeah, so I'll share the link in the chat
that'll
window.
be
Thank
great.
you.
Thanks, Alvin. And one last one. Anyone? Okay, Bunchai.
I forgot one point. I would like everyone to step back. I just finished my research on digital health governance. Now we're talking about digital health data governance. And if you search the Google, you will have the principle of the digital health governance, which is the bigger, the wider part that talking all the governance of the 7 components of the digital health. And our gaps, we talk both.
Yeah.
That's why I think this is a bit step back. When you Google, you can see that when they're talking about the governance or good governance in digital health, they're talking about the accountability, transparency, rule of law, ethics, efficiency, integrity, fairness, risk management, and openness. You can see that they operationalize the good governance in the big context into the data governance. Even digital health data governance principle is still not granular enough for us to do as a practice. So that is the point that I would like to give. And about digital health governance is also a very big issue, and we have to doing this.
Yeah, sure. And finally, Sami, Maldives.
Thank you, Dr. Fazilah. I would just like to say, as other participants have said, that the 8 principles we all agree, but the implementation is the difficult part. But I think we have to think of in a more positive aspect. For example, wherever, like we've seen in the presentation, wherever we have digital related health acts, so like health information regulation, the ownership, the data sharing, data security, those components would be covered. Of course, we would have aspirations to improve on the different areas. More of a positive aspect, I think we need to rethink of how we go about, like to build trust. in our recent experiences, we feel that when when there's participatory approaches from the very beginning, there's more trust built at all levels. When we used to like only think of the data as something that would be used like at the central level for our decision making, but when we change this approach to see the users for the ground level, how can they use the data for the parents? How can they use the data for other sectors? Like other authorities, like the councils, then there's more data usage at a national level. There's more confidence in our health system. More people are using our system for their information. Otherwise, everybody builds their own system and it becomes difficult for everybody to manage. Now coming to the different aspects, like I think in our aspect, we need to work more on the data interoperability aspects more, because there's a lot we need to work on, like the standards, different aspects of interoperability. Thank you.
Thank you. I think for the next 2 days, we'll be also addressing gaps, where in there a lot of this discussion will also again appear. And also, I think building trust is actually, the COVID has shown that building trust is actually one of the most important thing in digital health. Okay, now I think we don't have much time. Moving forward is about the global buy-in. Transform Health is proposing to bring a resolution to the 76th World Health Assembly in around May 2023. Yeah, so and also after which Transform Health is hoping that this principle is adopted or adapted by country or with the local context. So perhaps we can go through the resolutions. And this is the draft resolution, and as many countries are here, we would like to have your comments, or if you think this can be, if the resolution is okay, or is there anything needs to be added or removed. So this is the time for us to give the feedback to Transform Health.
I think most of you might have already seen those link to the draft resolution that we had shared. So please feel free to actually suggest to us whether that's acceptable, because this is the step which the member countries, the member states, the countries have to take forward. So whether this draft resolution fits in neatly within your perspective, especially the ministries of health, or even other ways of supporting this. So please feel free to tell us, like, is there anything that needs to be modified, especially, or corrected, added, removed, whatever it is, because this feedback to Transform Health will be very helpful. And then AeHIN, as a partner of Transform Health, would like to help with this. Thank you.
Does everyone who has this resolution? Who has seen this resolution? The 7 countries, 7 who presented today. Yeah. So the 7 who presented today, you have seen the resolution. So maybe perhaps we can start with you. And then I think to the rest, we can ask Transform Health whether that can be shared, and to get feedback for the next few days, it can be emailed to them. So maybe we can start with those who have already has the resolution, especially the 7 countries who presented. If you have any comments or things to be changed, can we just sort of just glance through this resolution? This is the draft resolution that is going to be brought to the World Health Assembly. So it has many things, yeah, it's quite detailed. It's all surrounding data, you know, and also about the governance model. So if anyone would like to make any comment or think this is for those who have already got this document. Maybe at the same time, we can slowly also show this resolution. So maybe we can start with Philippines. Ms. Charity, if you have any comments.
Can we make it more, anong tawag doon? It's shorter.
It's too lengthy.
It's too lengthy. And yeah, it's too lengthy. So maybe what's the term there?
You shorten it, make it simpler.
And it's there's too much.
Okay.
I think it's talking about too many aspects. So maybe we can make it more focused.
Okay.
Maybe.
Is Transform Health online? Are they still online? Is Transform
Yes.
Health online? Yeah. Okay. So that is one of the feedback. In fact, I myself have read this document. I think when we are going to for resolution in World Health Assembly, it should go straight to the point. What is that we are bringing, and what is it that we're proposing? But it's actually very lengthy, and it's not talking about the framework, the principles, and I think it also should explain why do we want to bring to have this global buy-in. So that is the comments, some of the comments.
I think we have Kirsten
Yeah.
online, so we'll hear from her. But from what I know, typically the drafting has gone into the mode in which like how other resolutions in WHO are drafted or adopted, because sometimes that's a language that could go in such a resolution. That could be probably a challenge to do it more in a simplistic term. Over to you, Kirsten.
Thanks, Jai. Yeah, this is very much actually builds on and framed around other similar resolutions, for example, on digital health that have gone through WHO resolutions. But with then giving the kind of preamble and background and then going into the specific requests that would be for member states as well as for WHO, with one of the core asks them for WHO to initiate the process for actually developing a framework. So just to say that the resolution itself isn't around endorsing a framework, but rather around initiating the process to then develop such a framework. So really to kick off that process for that to start. And just to say as well, just to clarify that this is very much, and we can share the link for it, absolutely. It's very much just to initiate that discussion amongst member states, because of course it's member states themselves that need to take forward a resolution to the World Health Assembly. This is very much just to put something on paper to start to initiate that discussion amongst member states. And then of course there are the WHO processes through which member states would negotiate on the content of a resolution. This is very much just to have something on paper to start that discussion. I'm really encouraging then as well governments to support this and to get those champion governments that can bring others on board and really take this forward to propose it on the World Health Assembly agenda. Thanks.
Yeah, Charity, you have something to say. Yeah.
In addition to what she said, every year before the WHA, we are made to make intervention papers to present to during the WHA. So maybe we can do something like that.
Yeah, so I think that is one way. If the member states, we can do an intervention paper on health data governance principles. But Kristen, I also have one more comment. Is the preamble is a bit lengthy because when I read the preamble, I wasn't sure where is this going, and so I thought maybe I don't know. I felt that it should upfront say why are we bringing this paper, and then preamble can just be like a background information. So that's my comment. And also waiting for 2020 in the roadmap for 2025 to 2026, I think it's too long. It should, if the principle is ready, it can be adopted. It's a universal principle, so we don't have to go through explaining to WHA the processes and so forth. So that's my personal view. So anyone has other views? Yes. Okay, we have Ahmad, and then we have Sami, and then we have Aizuddin. Who else? Okay, go ahead, Ahmad.
You have 10 minutes.
My question is, I guess more like a comment. I think one is that we should be forthcoming if there are plans for there to be country report on the progress of adoption. And then with regard to why am I bringing that up? Because although the resolution is, again, hard to disagree with because they're based on universal principles. But when it comes to operationalizing the resolution, for example, in this room alone, the majority of the countries are not signatories of the UN Charter for the Rights of Refugees. So if the word refugees is inserted in the country progress, there may be difficulties in one, collecting data, two, is actually enforcing. Although the spirit of it is good, but it may bring up some kind of resistance from the member countries.
Yeah. Kirsten, you got that? I don't know whether did you hear?
Yes, yes, I did. Yeah.
Yeah.
Yeah, no, and actually, I think this is something. So again, just say this proposed resolution for discussion and hopefully support of member states is very much to initiate the process to develop a global framework, and then that obviously will take some time, especially if it's done properly through a fully inclusive and transparent process. And that's why kind of the subsequent timelines of ideally then that comes back to the World Health Assembly next year for adoption. But in terms of reporting, that sort of thing then would of course need to be discussed by member states through the development of the actual framework and any subsequent resolutions, which would then endorse the actual framework. So again, this is just to initiate the process, but then needing to develop the framework, hopefully then ensuring that is underpinned by the principles themselves, which the principles are very much, normative guidance around strengthening the equitable governance of health data, whereas the idea of proposing and developing a global framework would be to almost translate that into what the common standards would be across countries for that, which could then be implemented into national regulation. But yeah, I think in terms of, country reporting and what that looks like, those are the sorts of things that would then subsequently need to be discussed by governments and WHO, et cetera, around the development of a framework. And as it comes back for full adoption, what that reporting then would look like.
Yeah, thank you. Sami?
Thank you, Dr. Fazilah. We've gone through the resolution, but like WHO is a member state driven organization with 194 countries. So to get any resolution or decision endorsed, it would mean that all the member states have to agree to each word, like in the preamble and PP, and also the operative paragraphs. So there would be like lots of debates on each text, each word in the resolution.
Yeah.
It would go on for days. So the best option would be to have a smaller one, to like wherever we feel that there wouldn't be agreement between member states, like a refugee, the word refugee. If we are to endorse, then we should delete any paragraphs that, seriously, if we are to endorse, we have to delete any paragraphs where there would be conflict, because to get member states to discuss on those paragraphs would be much more difficult, and it would take years to get endorsement. But in the discussions in this room, we know that there is agreement on the principles.
Right.
So if we have something simpler, if we have like less paragraphs in the PP, as well as the OP paragraphs later on. So I see that in the OP paragraphs, like the OP1 is for member states. They are also like number 1, we see that it calls for the development of a global, for member states to collaborate with WHO for the development of a global health data governance. But again, OP paragraph 3 talks about it should be guided by equity in human rights. So it would be best if we have like one paragraph for member states to support WHO to develop the global framework underpinning the guided by equity or human rights. So in that one paragraph, it is better, I feel, that we add any principles or anything that we would like member states to consider in developing the global governance framework, rather than having different OP paragraphs referring to the global governance framework. Now, in the request in the OP2, in the request for the DG, also I see that like many paragraphs that we could really like put into one OP paragraph. So we have to be very specific in our request to the WHO. So if we want WHO to work on a global framework, we have to we can even say to develop the global framework with these principles in this time frame. to present to member states by this year to the World Health Assembly. But then usually I find in the discussions in the World Health Assembly, if we have other actors and if we have no conflict of interest, it's more difficult. Yeah. So what would really go through, I feel with member states would be a member state mechanism, but where like experts or other organizations could give input. Thank you.
Thank you. Thank you. That's great.
Thank you, Sami. This is very comprehensive. I'm glad that someone has gone through the whole resolution in detail. This is very helpful. I'm sure that Kirsten is very happy with you. I think most probably, I think she will also reach out to you for more specific assistance on this. I think we have 2 minutes. Yeah. Is there anyone else who would like to share? Yes, please feel free.
Yeah. Sorry, before that, just one comment. Yes, I think we have to remove words that where member states will not agree. I think this is a lessons we have learned in many World Health Assembly. Just with 1 or 2 words, then the entire resolutions get thrown out the window. So I think it's very important.
I think it's a fine balance between the details and means the granularity and keeping it general, acceptable politically also. Thank you.
Yeah, it's okay. Go ahead.
Yeah, mainly on comments, I think we pretty much agree on the principle. But as a researcher, there's one thing I wanted to ask about facilitate innovation using health data. Should we talk a bit about open science and open data within this resolution? Not to complicate things,
Talk louder.
just whether it need to be mentioned in this resolution moving forward. Because in order to facilitate in innovation using health data, that's need the principles of open science and open data. Yep.
So that's one more additional point, I think, which is not in the principles for using data for solutions, for research and for innovation. So, well, I hope you have got that. So I think we have 1 more minute. I have to wrap up. So it's been very good feedback we have received. And also we have all heard about the country landscape from 7 of our 7 countries here. And at the same time, we have had discussion about the use of the principles in various countries, and also the discussion on the resolution. And some of the points for the resolution is to make it simple, and also to remove controversial sentences of words, so that it's easy to get a member states agreement. And at the same time, I think some of them have given very good input for the resolution. So I hope Transform Health is happy and you are able to get some feedback from us. And also, you want to add something?
Yeah, I think we have done justice to the partnership. Thank you. Thanks, Kirsten, for staying on very early in the morning. Thanks to stay for the entire duration of the workshop. And thanks everyone else. Like, I think we also have participants from India and Indonesia joining us. And then thank you very much for each and everyone who were with us today. Thank you.
Thank you very much.